hospitalizations is putting a dangerous strain on the state's healthcare infrastructure. And while healthcare in Ohio remains very safe, with providers working every day to protect patients and caregivers, we're in a serious situation. Hospitals are being stretched toward capacity, not only because of the high numbers of COVID-19 hospitalizations, but also as a result of staffing challenges, particularly among the dedicated healthcare workers who have been fighting this virus on the front lines day in, day out for more than 18 months. Hospitals are having to make difficult decisions and implement plans that alleviate that pressure on their systems and their staff. Some have had to reschedule elective procedures. Some have diverted patients to other hospitals or have implemented patient visitation policies. And as we've heard, some have temporarily even reached their full capacity. When we hear about these necessary responses, it should raise some alarm, as none of us want our hospitals to get so busy that there isn't a bed for you in the hospital if you need it. Of course, despite how busy our hospitals are, if anyone has a health emergency, they're suffering symptoms of a stroke or are in a car accident, they should, of course, not hesitate at all and should call 911 to seek emergency medical treatment. However, if you have mild routine health concerns, you're encouraged to evaluate your symptoms and call your provider to discuss your healthcare needs. You might also consider whether a telehealth provider might be able to help diagnose and treat you. What about a nearby urgent care center or clinic inside of a pharmacy or grocery store? And if you still need to go to the emergency room, please do. But recognize the wait may be significantly longer than usual. And if you're experiencing symptoms of COVID-19, you should really think about calling ahead to your provider, your urgent care center or hospital, to discuss if in-person medical evaluation is needed. If you think you might have COVID-19 with fairly mild symptoms, providers might also point you in the direction of COVID-19 testing, which is available at many pharmacies, libraries, and community providers statewide. Ohio hospitals are working collaboratively with other providers and state agencies to ensure communities continue to have access to needed healthcare services. Ohio's hospitals and the Department of Health maintain a robust regional zone structure to assure robust and timely resource management, communication, and emergency response throughout our state. Ohio's trauma network has been in place for years to help divert patients as needed to other nearby hospitals to receive necessary care when needed. Hospitals run preparedness drills and testing and put those plans into action. If you need medical care, rest assured, Ohio's healthcare system is responding to ensure you get what you need. But as I said earlier, we are facing a challenging situation. So the best thing we can do to alleviate the pressure on hospitals is to choose to be vaccinated and wear a mask when advised. Remember, the lion's share of those who are hospitalized with COVID-19 remains those who are unvaccinated. As we've discussed in previous weeks, we continue to see our surge amidst the Delta wave drive cases and hospitalizations ever higher. Yesterday, we reported over 7,000 cases from the previous 24 hours, taking our 21-day reported case average above 6,000. And in that same 24-hour period, it was reported that 292 Ohioans were admitted to the hospital. Now, I think it's important to compare this information to previous times in the pandemic. So, last year, on that same day, September 15th, the 24-hour reported change in cases is just over 1,000, with 103 new hospital admissions. So as you can see, from 1 year ago today, even though about half of us today are well protected by vaccination, our daily hospitalizations are about triple what they were last year. And the reason is simple. The Delta variant is aggressively seeking out anyone who lacks immunity and is making many of them very sick. Yesterday, across our state, there were over 3,500 patients in the hospital with COVID-19. More than 900 of them were battling the virus in the ICU, and almost 600 were on the ventilator. Furthermore, as of yesterday, the Ohio Hospital Association reported that statewide, about 1 in 6 patients in the hospital has COVID, and that about 1 out of 4 in the ICU is battling COVID-19. Hospitals in rural Ohio continue to see ratios that are even more troubling, with 1 in 3 patients hospitalized being COVID-19 positive, and about half of all the patients in the ICU battling COVID-19. Today, across our state, the case rate per 100,000 residents was well north of 600, and daily reported cases over 7,000. That means the figures we're seeing for COVID-19 cases, hospitalizations, and ICU admissions are all reminiscent of what we saw during our winter surge and are far from what we were seeing as recently as early July, when the number of statewide cases per 100,000 residents was all the way down to near 17. Daily reported cases were in the low hundreds, and there were about 200 Ohioans in the hospital with COVID-19. Now, I'm joined today by 2 doctors who are really well positioned to share more about what we're seeing on the front line in the hospitals in Ohio. First, I am joined by Dr. Michael Kennedy, Chief Executive Officer at Holzer Health System, with hospitals in both Gallipolis and Jackson, Ohio. Dr. Kennedy, with so much information swirling around, it's sometimes difficult for Ohioans to separate fact from fiction. And it's important that they hear about what's going on in their community and hear it from trusted medical professionals. Dr. Kennedy, what are you doing to speak directly to your community about what's happening in this pandemic now?
Thanks, Dr. Vanderhoff, for letting me share some of our experience today. We're doing just about everything we possibly can do. Facebook Live events, talking one-on-one with people. In fact, about 3 weeks ago, I was able to get the microphone before and at halftime of a local high school football game. And we had a few hundred people in the stands. And I was actually surprised I didn't get booed when I suggested that everyone should get the vaccine, but actually had a few applause. We're trying to reach out in every way possible. The numbers that you presented are very, very recognizable to us. We have probably 75% more patients with COVID at Holzer right now than we had at the peak of the surge back in the winter. We have 7 in our ICU. 5 of those are on ventilators with COVID. We have 73 patients at the peak. We got to 43 last year. Now, we're saved a little bit by the fact that we have a very aggressive COVID at home program, and about half of our patients are in the COVID at home program. But to your point about general medical problems, well, my biggest fear and the concern I expressed at the football game and to everyone that I can get to listen is I'm afraid that if someone comes in with a medical problem or a surgical problem that we would normally be able to take care of, that we won't have the ability to do that simply from staffing and beds. Now, we have physical beds, but we are so short-staffed right now, from nurses who have burned out, left, gone to nursing agencies, traveling agencies that are paying up to $10,000 a week to draw our nurses away. It's very challenging. I've been in healthcare over 40 years, and I've never felt so helpless. It's just and I don't know that the public knows how much we are really struggling with this and trying to do the best we can. But my fear has become realized. We had a patient yesterday with an acute emergency urologic problem that would have probably caused them to die within 24 hours, Our urologist was able to take care of it in the operating room, but then we didn't have a bed in the hospital for them to go to. So they had to go back to the emergency room and then be transferred to another hospital to take care of them. It's a day by day, very, very challenging situation out on the front lines.
Well, that's a really good segue, Dr. Kennedy. I know that your health system, along with those across the state, are really taking steps that are extraordinary, but are steps that are designed to stretch resources at this critical time and ensure that Ohio's patients get the care they need. Could you share with us some of the ways that you're innovating and stretching those resources?
Sure. I guess the thing that probably comes to the forefront is the elective surgical procedures. I'm not sure I ever really, I'm a surgeon by training. I'm not really sure what an elective surgical procedure means. We haven't completely stopped doing surgery, but we are trying our best to be very diligent in making sure that patients we operate on are not going to utilize beds unnecessarily for a significant length of time. The other thing we're doing is we're stretching our staff. We pulled all of our nurses in from our quality departments, from our care management departments, our chief nursing officer, every manager and every director in our system that normally wouldn't be working front lines necessarily are now working frontline shifts in order to take care of the patients that we have in the hospital. So we are, quite frankly, at a breaking point, and I don't know how much more we can handle without, unfortunately, patients not being able to get the care that they deserve in our healthcare system. Our mission is bigger than COVID-19, although COVID-19 occupies the lion's share of our resources right now. And so we've got to balance that to make sure that if we have a patient in our Jackson facility that needs a heart cath or a stent, that they can get in quickly, because that's key to those kinds of things, get the stent placed and live a long, happy life afterwards. And, 2 weeks ago, we had a patient that took 10 hours to get from the Jackson facility to our main campus to get that exact procedure done, not only because of problems that we have, because it extends past us to transport, and we can't get ambulances to take the patients where they need to go sometimes. So it's a really difficult and dire situation on the front lines.
Dr. Kennedy, your hospital offers an innovative COVID at home program, which really allows patients who are able to stay in their home and receive necessary, vital home health services to manage their COVID-19. Can you tell us a little bit more about that program?
Well, it's run through our home health department. We have a cradle to grave kind of offering out here in southeastern Ohio. We deliver babies and we take care of patients as they die in palliative and hospice services. But our home health agency is part of our long-term care department, and they have been great. We have 30 of those 73 patients are in our COVID at home program today, and our home health nurses have just said, bring it on. We'll take care of as many as we possibly can, because we know that there are patients who need your hospital beds more. So it's been a very aggressive and rewarding, because the other thing is, whenever you come to the hospital with one problem, there are other problems that can happen as a result of being in the hospital. So it's always our goal to keep people out of the hospital as much as possible. And, to your point, we've also seen a significant increase in our ambulatory visits, our urgent care visits, and ER visits are just at a highest level I've ever seen out here. We currently have 13 patients waiting, boarded in our ER, 5 of them with COVID, just to get a hospital bed either here or somewhere that we could send them.
Well, in line with that, you, along with the CEOs of 8 other hospitals, recently came together and issued a joint letter asking for members of your community to help. Hospitals actually span several counties: Athens, Fairfield, Gallia, Hocking, Jackson, Madison, Meigs, and a number of others. What do you and your colleagues, leaders of hospitals and health systems, hope that members of your community will learn after they read that letter?
I think the message is, it should be like a mantra: go get the vaccine. Please go get the vaccine. We could have prevented where we are right now if we'd had vaccine in 80% of our population 3 or 4 months ago. I know there's a lot of political issues with the talk of mandates and things that have come out over the last couple of weeks, but we simply have to get those vaccines in as many arms as possible. Our staff hasn't taken it as willingly as I would like for them to. It's very challenging when people just don't understand that this vaccine technology has been around for 30 years. It's safe. There are no long-term consequences to vaccine like there are with COVID. And we know what the consequences of COVID can be. If you have a vaccine and you don't have a reaction, and there can be reactions to vaccines, nothing's without risk, but those are few and far between compared to the problems that you get with COVID. If you don't have a reaction from a vaccine within a month, you're probably not going to have a reaction to that vaccine. And I would just encourage that. When I ask people why they haven't gotten the vaccine yet, I hear, well, I'm just not sure about it yet. And I'm like, what are you not sure about? We've given 350 million plus doses in the United States, 4 billion doses of vaccine worldwide. It's the most studied vaccine in the history of mankind. It's safe, it's effective, it can save your life. And I wear an American flag a lot of days. I was in the Navy. When I stop to think about the lives that have been lost in this country over the last 250 years, in order to allow people to have the right not to take the vaccine. And I believe in an individual's right not to take the vaccine, but that right stops when it crosses over to the line of someone else's pursuit of life, liberty, and the pursuit of happiness. And, there's got to be a community spirit, a groundswell of community spirit in this country to understand, while it is an individual decision, that individual decision impacts everyone. And there are people who can't get the vaccine for legitimate medical reasons. There are people who are immunocompromised that can't get a good reaction to the vaccine. And if you don't get the vaccine and spread it inadvertently, you're putting others at risk. And I would just implore everyone, everywhere, unless you have a real medical reason or a potential religious reason not to get the vaccine, please go get the vaccine.
Thank you so much, Dr. Kennedy. Also joining me today is Dr. Brian Kaminsky, the Vice President of Quality and Patient Safety at ProMedica. Dr. Kaminsky, statewide, hospitals have faced a really dramatic increase in COVID-19 cases, with then the staffing challenges that we've alluded to and discussed. All of this is putting a real strain on our healthcare delivery system. What are you seeing at ProMedica's Toledo area hospitals, and how are you addressing those challenges?
Well, first of all, thanks for having me. I appreciate the opportunity to be here to discuss this important topic. And for starters, I'll tell you that what you're going to hear me say is going to sound really similar to what you heard Dr. Kennedy say. And I'm sure I couldn't say a lot of things as well as he did, but it is going to sound similar. So what we're seeing up in Northwest Ohio is extremely similar to what you just heard described. If there's a way to describe it, the phrase that keeps coming to mind is perfect storm. And COVID is a big piece here, both directly and indirectly. So a large portion of the patients that we're seeing, for us, it's right now around 1 in 8 patients that are hospitalized because of COVID. But then all of those indirect consequences that are having an impact as well. The staffing shortage is largely a direct result of COVID. So we can tie back those people who are either unable to come to work, who are not coming to work right now. A large portion of those people, either directly or indirectly, it's related to COVID. Volumes have shot through the roof. So we experienced in our emergency department a period of time of about 12 to 14 months where we had reduced volume. People were afraid to come in and receive healthcare. That tide has turned. We have lessened that fear. People understand that they can safely come into our hospitals. And there's been pent-up demand during the course of the last 12 to 14 months where the volume that we lost during that time period is now coming back, and it's coming back in full force. So we're seeing some emergency departments, 120, 140% of their pre-COVID volumes. And when you combine that all with the staffing shortage, it just makes it more difficult to continue to provide that safe and effective care that we need to our community on a regular basis. So we're challenged from all directions. It's all those influences that are creating a difficult situation to take care of patients walking through our front door, coming in through EMS, and then also our planned visits through surgery and admissions from outside sources.
Dr. Kaminsky, we've heard other hospitals, other physicians who have been on these conferences say that by and large, the patients hospitalized because of COVID-19 are still unvaccinated. Is that in line with what you're currently seeing?
Yeah, so that directly aligns with what's being seen across the state and across the country, well into the high 90th percentile. Those people who are sick enough with COVID to be admitted to the hospital are the unvaccinated group. We are seeing breakthrough cases. So we knew we would have some, and with Delta, we're seeing more than with the previous strains. So there are breakthrough cases out there, which is important because even though you've been vaccinated, you can contribute to the spread of COVID. And when it reaches those unvaccinated patients, then they often result in admissions to the hospital. And so in the high 90th percentile, those patients that are admitted with COVID are the unvaccinated group.
Thank you. Now, we know, and we've been alluding to this in some of our conversations so far today, that this is an incredibly stressful time for so many healthcare providers. They've been really on a marathon, and now they're many miles down that road and running uphill again. What's the general mood or feeling inside the walls of ProMedicus hospitals?
Yeah, so earlier this summer, I think we were all reaching a point where we felt like we were putting this to rest, and a lot of the restrictions were loosened, and we weren't wearing masks for a while outside of the hospital setting, and so people started to get used to that. And then with the Delta surge, we went back to the pandemic as we knew it before. So, the mood is very somber. People are definitely stressed. It's very rare that you run into healthcare workers, patients, and family members that have not been impacted by COVID in some very meaningful way. And so people are feeling the strain and feeling the stress. On the flip side of that, I have seen heroics in the emergency departments and in the hospital. Like Dr. Canaday said, we've seen managers, directors stepping up to provide direct patient care where frontline staff just aren't available. We've seen those who are showing up to work in this environment come in and perform great service day after day. So I don't want it to be unrecognized. The healthcare force, both clinical and non-clinical, that continues to show up and provide care at great personal risk to patients that need our services, whether they be COVID patients or non-COVID patients. So it really is a mixture. It's been a bit of a roller coaster, and we see some very meaningful heroics and great caregiving, and all the same time, those same caregivers are feeling the stresses and the weight of the system literally being stressed to its max at this point.
Dr. Kaminsky, earlier this week, we heard that there was a brief period of time in which all 8 hospitals in Lucas County had to go on EMS bypass. This included 3 of your hospitals. Can you tell us what it means to be on EMS bypass, and what's the impact of that on the community?
Right. That was a really significant event and very important for our community. I've been working as an emergency physician for the last 22 years in our community, and we've always known that this could be a possibility, that, all hospitals, we have 8 hospitals in the county where I practice that, work with the local EMS system. And at one period of time, every single hospital has been on EMS diversion at some point. And we knew that there was this theoretical possibility that, given circumstances, we could all be on bypass. And On that day, which was on Monday, what had happened is that our two largest hospitals, Toledo Hospital and St. Vincent Hospital, went on bypass fairly early in the day, and it really created additional strain for the smaller facilities. And it was more or less a domino effect. So once those two fell, the others were fairly quick to follow after that. And then by late in the evening, around 9 p.m., our last hospital in the area had gone on EMS bypass. And that's the first time I've ever experienced that. Fortunately, we have a very good county healthcare delivery system and EMS system, and we have a mechanism in place that allows us to more or less hit the reset button when that happens. So we all had discussions that evening, and some of the discussions with our EMS medical director, and we activated a red alert process, which in essence opens up all hospitals again. So instead of working within the grid like we usually do, what happened was all 8 hospitals opened back up once that last hospital closed to EMS. And we started alternating EMS transports. That provided enough of a breather and enough of a reset for hospitals to start to come back online. And then by 12 hours, we had about half the hospitals back online. And then by the next afternoon, we had all hospitals back in the county back online and accepting all EMS patients. So it wasn't a good position to be in. And it's certainly the strain that we have all discussed, all the reasons that that occurred. But we recovered pretty rapidly from it.
Thank you so much, Dr. Kaminsky. Well, it's clear that frontline healthcare providers across the state really do take great pride in their mission to ensure the health and well-being of every Ohioan. However, when hospitals are faced with historically high numbers of COVID-19 cases, along with staffing and other challenges, our systems naturally become strained. To help alleviate this pressure on hospitals, we all need to do our best to prevent the spread of COVID-19. And that includes especially choosing to be vaccinated, because vaccination is our best key to staying out of the hospitals and our best opportunity to allow our hospitals to continue their important work of saving lives. The prevention methods that we've talked about many times before continue to provide the best protection possible against COVID-19 and its variants. Like layers of sun protection used in conjunction with one another, we can provide the best possible protection. Vaccines, masking, and other prevention methods all work together to protect us from this virus. The best layer, of course, is COVID-19 vaccination. When more Ohioans choose to be vaccinated, together we reduce the opportunities for this virus to spread, to mutate, and to inflict serious harm in our communities. But like wearing sunscreen, a hat, and long sleeve clothing to gain maximal UV protection, additional layers of COVID-19 precautions can help prevent ourselves and others from getting sick. Wearing a mask prevents respiratory droplets from spreading. Additional protection methods include keeping our distance from others, avoiding congregating in large groups, improved ventilation, and frequent hand washing. They all help. We should all choose to take the necessary precautions to slow the spread of COVID-19, and in doing so, protect ourselves and our communities. With that, Alicia, I think we can open up for questions.
Thank you, Dr. Vanderhoff. Our first question comes from Allison Walker with Dayton 24/7 Now.
Hello, everyone. Thanks so much for taking the time today. I'm just hoping to learn more about how widespread is the increase in breakthrough infections in nursing homes across Ohio. How severe are these infections? And is the state going to release updated visitation guidance since the booster shot timeline is uncertain?
Well, thank you for that question. Fortunately, as we're looking at breakthrough cases in Ohio, while there have been some increase with the Delta wave, the cases are still extraordinarily rare. Our nursing homes across the state actually are taking very responsible approaches to keeping their residents safe. And, there's an important balance here, and we've learned this as we've moved through the pandemic. There's an important balance between the benefits that come from avoiding social isolation for the residents of many of our nursing homes, avoiding situations in which they are cut off from family and loved ones who are an important part of their health and well-being, and balancing that with the safety of protecting the residents of the nursing home. So the number one most important solution is for those residents and for their visitors to choose to be vaccinated. And so we continue to strongly recommend that choice. But the other, of course, are the measures that our nursing homes are taking. Measures that include masking, measures that include social distancing, and being very mindful of the environments in which visitations take place, with a particular focus on the ventilation. And so you'll see in many circumstances, with the weather still being nice, many of our facilities encouraging those visits to happen out of doors where possible, and others in much larger spaces. So we continue to monitor the situation very, very closely, but we continue to see a very responsible approach being taken by our nursing homes.
Thank you, Dr. Vanderhoff. Our next question comes from Spencer Hickey with Hannah News.
Thank you. And Director, if you and Dr. Kaminsky could answer this, could you talk about how the staffing issues and burnout that's been discussed could affect Ohio's healthcare workforce in the years to come, even after the pandemic?
Well, thank you. I'll kick off at a very high level and then turn to Dr. Kaminsky, who grapples with these questions on the front lines. So I think we've all recognized that one of the impacts of COVID-19 has been on the emotional health and wellness of people in all walks of life. And certainly our healthcare workforce has been particularly impacted. I think one of the benefits that will come from our experience in this pandemic is an enhanced and improved focus within healthcare on the health and wellness that from an emotional and a psychological perspective, the health and wellness of our colleagues and our workforce, and taking time for decompression, taking time to have a few moments throughout the course of the day to meditate or to reflect or just have that downtime. So there are a lot of innovations that are already underway. And I think that is going to be one of the great legacies of having gone through this very difficult time, is an enhanced focus on the health and wellness in the workplace of our very important healthcare workforce. Dr. Kaminsky, what would you add to that?
Sure. I still think there's quite a bit of unknown. I mean, what we realize right now is that we're all experiencing a workforce shortage, and that exists inside and outside of healthcare. And I don't know that anybody's qualified or knowledgeable enough to be able to predict what's going to happen, 3 months, 3 years, or 3 weeks from now. What I do know is that the employees that I see, that I work with, that I talk to, they remain engaged with their work if they feel that their work is meaningful, if they're supported by their leaders and their managers, and they feel safe when they come to work. And so I think this is a time for leaders to lead. I happen to have children that have not entered the workforce yet and are still, considering what careers they want to plan for their lives. And, I have one who's still particularly interested in healthcare, and he's doing some work with COVID right now. And so it doesn't seem to scare him away, the fact that we're all going through this. So I think to the extent that our new and budding workforce can be engaged and be helped along to understand that this type of work is meaningful, and that with good leadership along the way, we will have continued engagement of our workforce and continue to be able to provide this very meaningful and purposeful work that we do.
Thank you, Dr. Kaminsky. Our next question is from Joe Ingalls with Ohio Public Radio and Television.
Thank you, doctors, for this opportunity. I have had people asking me, since they've been hearing these stories about the capacity being short in hospitals, they're asking, why don't hospitals limit the number of COVID patients that they'll take so that they can take on the heart attack victims and, people who have other issues that require hospitalization and immediate care? They don't feel like it's fair for hospitals to take in all these COVID patients. And then, when especially someone who's been vaccinated and has been doing the right things as they see it, gets sick or need medical care, they get shut out. Can you address that?
Yeah, I'll start off. Thank you for that question. I think the bottom line is that as doctors, nurses, and other healthcare providers, that's just not in our DNA. We think in terms of ensuring that every sick person has the timely opportunity for the best care possible all the time. And so here in Ohio, we've really gone to extraordinary lengths to ensure that we can stretch and expand the capabilities of our system. I referenced a number of those infrastructures that we've put into place to ensure that we have really among the nation's best levels of integration and cooperation among healthcare delivery systems that you could look for. So we have an impressive ability in Ohio to work together, to balance the load, to share resources, to ensure that people are getting what they need. And I think our plea right now is we don't want to get to that point. We do not want to arrive at the place where we have to make difficult decisions regarding who gets prioritized for urgently needed care. Nevertheless, the message I think that we're sharing, and I think one of the examples that Dr. Kaminsky shared really points to the fact that we're becoming worrisomely close to that limit where we would have to cross a threshold into decision-making that we want to never have to make. So for now, we're really gratified that we continue to have the ability to meet the healthcare needs of people with all diagnoses, but we need more people to get vaccinated to ensure that this virus doesn't interfere with our ongoing ability to provide care in that way. Dr. Kaminsky, what would you add?
Yeah, well, I can certainly understand that feeling and, that mindset, especially when we're all stressed. But, at the end of the day, all of us, all healthcare practitioners take an oath, and it's to take care of people in need. It's not to take care in need of certain people and not others. And we don't judge based on socioeconomic status or other factors, and we don't judge based on vaccination status. Our preference very strongly is that everybody get vaccinated, but when it comes to providing needed care, there's no judgment. And so we have to continue to take care of people. It's really the only way to operate individually and as a healthcare system and as a country to be able to continue to provide care to those in need. End of story, not judgmentally.
Thank you, doctors. Our next question is from Marielle Carbone with WCPO.
Hello, and thank you guys for all hopping on here for a little bit to talk with us. Obviously, we're hearing all of our hospitals and healthcare workers and even some of our state and local officials just talking about the fact that we're on fire right now with COVID cases, but we're still seeing huge events happen. I mean, this weekend we have Oktoberfest that's kicking off today here in Cincinnati, and it's going to be packed crowds. all weekend and into next week. So even though it's outside, I mean, are you guys concerned that we're still seeing these events even after everything you guys are saying? And if so, what do people need to know about going to these events?
Well, thanks for that question, and I'll certainly kick it off. Look, we're at a very important place now in a very long journey of contending with COVID-19. And we're at the place where our collective success and our personal health really depends on our personal responsible decisions, our response to what we're facing. Our message has been extremely clear. First of all, the best protection you can gain is to choose to be vaccinated. Vaccination, hands down, is your best protection, and it's the best way you can protect the people around you. So go out and get vaccinated. In addition, we have said, look, there are environments that place you, even as somebody who's been vaccinated, at an increased risk. Wear a mask, maybe consider even avoiding those situations. Now, it's absolutely true that in the warm weather, which we're still enjoying, sunny weather, when we're outdoors, the risk of transmitting or getting COVID-19 goes way down. But the fact is that if we're in a very crowded situation, even in an outdoor environment, there can be transmission. So there, if you know you unavoidably have to be in a crowded situation, we strongly recommend that you wear a mask. And certainly if you're unvaccinated and going into any public environment, it's the best decision to wear a mask. So we continue to message that. We continue to look toward the people of Ohio to be making good and responsible decisions about how they are going to conduct their affairs in the face of COVID-19. Dr. Kaminsky, what would you add?
Those are all great points, and we are fortunate that we're still in the latter half of the summer months, and I'm hopeful that we continue to have the warm, nice weather into the fall. We've had data now from a lot of big events. There were large numbers of outdoor concerts this summer, and there was some contact tracing that was done through that. And fortunately, what we're finding is that the large outdoor events tend not to be these super spreader events, and it's more linked to the events that occur either before or afterwards indoors, where people actually start getting together. So, I fully understand that the general public is tired of restrictions, tired of mandates, and there's a significant degree of fatigue that's going on for people to return to activities that they remember prior to the start of the pandemic. So to some extent, I think the inertia behind that made a lot of these events literally inevitable. And hopefully, like Dr. Vanderhoff stated, that if we continue to inject the importance of those preventative measures, if you are going to go attend one of those events, first and foremost, please be vaccinated, wear a mask, and when you have opportunities to distance yourself from other people, please do that. And those things are not risk-free, but substantially decrease the risk of transmission.
Thank you, Dr. Kaminsky. Our next question is from John London with WLWT News 5.
Dr. Vanderhoff, since Tuesday's direct appeal from Children's Hospital CEOs to Ohio school superintendents, have any of those school leaders altered their policy to require masks in schools, if you know? Because, this morning there was an influential state representative, a veteran, who told me he foresees absolutely no movement from the legislature about masks. He also said 3 family members of his under the age of 12 who attend a mask-mandated school got COVID. So his question is, he rather sarcastically texted me, tell me again why mask mandates work? So let me pose that one to you as
well. Yeah, thank you so much for that question. So I think as we shared during that press event on Tuesday, it's clear that there has been a lot of dialogue happening across the state regarding our children and creating safe environments for our children in school. a lot of dialogue about the importance of vaccination and supplementing that with masking. We've now seen, as of earlier this week, and I think we shared these numbers on Tuesday, at that point, it was clear that we had crossed the 50% threshold in terms of students who are in our schools and actually in environments with masking. I don't know how that number has changed over the last 24, 48 hours, but what I can tell you is this. We are very aware of an enhanced dialogue that is happening in communities all across the state about the importance of working together to keep our children safely in school, a recognition that being in school is vitally important for our students, not only for their education, but also for their emotional well-being, for their development as whole people. So I'm really encouraged by those dialogues. Those dialogues, I'm sure, are going to continue in the coming days. And I think more and more people are recognizing that the most important intervention that we have, the one that will ultimately be the key to getting us out of this pandemic, is vaccination. But vaccination just is not available for all of our students. And in many circumstances, the vaccination rates in many of our schools are very, very low, even among those who are eligible. So in those circumstances, we've got a proven past track record that we can look back on. And that is last school year, where it was very clear that in environments where there was wide application of masking and distancing and keeping the environment clean and being mindful of ventilation, we were able to create a very COVID-safe environment for those students and keep those kids in school. So, Dr. Kaminsky, I don't know whether you have anything that you would add to that a comment, but I certainly would give you that opportunity if you do.
Not much. The only thing I'd mention is that the data would suggest that masking really does work, and there is no measure that's 100% preventative. But when you look at the large populations of school-age children, the benefit of masking certainly has been demonstrated by way of the evidence that's out there. So it's one of those things where no matter how many measures you put into place, if you're going to bring people in contact with each other, you run a risk, but that risk is significantly lessened with masking, especially as it relates to source control. And we know that children are more likely to have asymptomatic disease. So it just makes great sense to me.
Thank you. Our next question is from Ann Saker with the Cincinnati Enquirer.
Good morning, Dr. Vanderhoff and Dr. Kaminsky. It's good to see you. This is mainly, I think, for Dr. Vanderhoff. What's the plan for the September 20th rollout of third shots?
Thank you. Very good question. The booster plan is still subject to the FDA's independent evaluation and determination of the safety and effectiveness of adding a booster dose, as well as then the CDC's Advisory Committee on Immunization Practices, the ACIP, issuing their booster dose recommendations based on a thorough review of the evidence. So at this time, we're reviewing the data and then awaiting that scientific guidance and determination from both FDA and ACIP. Now, consistent with the CDC's reporting, we do plan to track any additional authorized doses and then to report that information on our dashboard. In addition, we've been working on distribution plans with all of our vaccine partners that are cognizant of a range of potential authorized scenarios to ensure that if boosters are authorized, when they become available, we'll be well positioned to begin that distribution very rapidly and ensure that people who need the booster, if there's a determination that those are needed, can go out and get the vaccines. However, until the federal government makes final recommendations on whether a booster really is called for by careful evaluation of the emerging scientific evidence, and then determines who is eligible and when, we simply cannot finalize our plans.
Thank you, Dr. Vanderhoff. Our next question comes from Courtney Wheaton with Local 12.
Hi, we mentioned Oktoberfest. I'm actually covering that today. And a lot of people I talk to do say like, hey, we're safe in the sense that, you know, outdoors are safer. But can you, again, just explain the Delta variant again and how it's different than the original? Because I think they're going back to that original data. And I think the Delta variant might be a little bit more dangerous, especially with 500,000 people over a 3-day weekend.
Yeah, thank you for that question. Because I do think it's very relevant. We do need to think about COVID-19 now as COVID-19 resulting from the Delta variant. The Delta variant is incredibly contagious, and it has demonstrated a really remarkable ability to make more people sicker quicker. So with that in mind, we have to think about, well, what are the layers of safety that we can surround ourselves with? And I know I'm going to sound a bit like a broken record, but it's pertinent. Look, our COVID-19 vaccines continue to provide us with remarkable levels of protection. They continue to this day to protect us very well from serious COVID illness, hospitalization, and death. Nevertheless, COVID-19 has now evolved in the Delta era, and we do see some level of breakthrough. It's still relatively small, but some level of breakthrough so that vaccinated people can develop more mild illness. And I think people have to be mindful of that. So as we're looking at activities, it's much like the way that we look at other risks in our lives. We have to ask ourselves, okay, am I taking all the reasonable steps I need to take? And is this a safe environment for me to be a part of? So if you're going to a large group setting and you really feel that's the right decision, number one, if you're not vaccinated, it's not too late to go out and get vaccinated. Yes, it takes a little time for your immune system to build up that immunity, but there's no time like the present. So get out and get vaccinated. Number two, if you're going to be in a group environment, outdoors is dramatically better than indoors. And as Dr. Kaminsky referenced, thankfully, thus far, we are just not seeing large outdoor venues proving themselves to be super spreader events. So that's an encouraging thing. But we have to use common sense. And if we're going to be in a situation where, despite being outdoors, it's a crowded situation, I think the prudent thing to do is to put on a mask, because masks have been shown to help reduce the ability of one person to spread droplets with other people and then to protect people from the droplets coming from others. Good hand hygiene, etc. So we're again at a stage in this pandemic where it is incumbent upon all of us to be making responsible, good decisions, not only about our own health, but about that of the people we're around, the people we care about, the people we live and work with. And I would ask everyone going into those environments to have these thoughts in mind.
Thank you, Dr. Vanderhoff. Our next question comes from Pete Grieve with Spectrum News.
Hello. We've heard a lot about high case numbers and large numbers of quarantines at the K-12 level. I wanted to ask how that compares to what the state is seeing among college students and sort of the 18 to young 20s demographic with COVID-19.
Well, what we're seeing with COVID-19, especially now with the Delta variant, is we used to have a situation in which COVID-19, if we circled back to last winter before we had vaccination, before we were dealing with the Delta variant, COVID-19 was far disproportionately impacting older Ohioans. That's not true anymore. As we look at the distribution of COVID-19 cases, particularly those that are hitting our hospitals, we're seeing that COVID-19 now is more widely distributed. We're seeing more and more younger Ohioans, people in their 20s, people in their late teens, who, in fact, are not only getting COVID-19, but are getting sick with COVID-19. And again, who are they within those age brackets? They are the unvaccinated. So the pattern that we're looking at is that if you're unvaccinated, regardless of your age, you're putting yourself at great risk, particularly if you're not taking additional measures, additional steps to protect yourself when you leave your home. You need to be thinking about, is it time for me to get vaccinated? I think both Dr. Kaminsky and I would say yes. And if you're going to be going out and you're not vaccinated, you really need to think about putting on that mask and avoiding those large group settings. Dr. Kaminsky, I don't know in the Toledo area if you're seeing anything that you would add to that picture.
No, at the risk of sounding repetitious, I'll just let those statements stand as they are. It is a repetitious theme, but I think you said it exactly right, and those are the ways to stay safe and healthy.
Thank you, doctors. Our final question today comes from Eric Halperin with NBC4 Columbus.
Doctors, thank you for taking the time today. Dr. Vanderhoff, we've had press conferences and events and conversations before talking about how serious the situation is in our hospitals. And here we are again having the conversation today. What do you think needs to happen for people to, really get that message and, take the message seriously when it comes to vaccines and masking for those who maybe aren't taking that seriously right now?
Well, I think that so often in our lives, things really become much more real when we directly encounter them, when we see them happening in our own communities, when we see them happening, perhaps even among members of our own families. And I think that's happening now in the midst of this incredible wave of COVID-19 cases. And the reality is that, and this was stated by one of my physician guests earlier, the reality is, I believe it was Dr. Kennedy, who said, if all of us were vaccinated, we just wouldn't be seeing this right now. The fact is that as doctors, we're seeing what is essentially a pandemic of the unvaccinated. And the message, I think, for everyone needs to be, vaccination is making an incredible difference. Vaccination is providing an incredible level of protection. And if we all choose to get vaccinated, we really do have the opportunity to put this pandemic behind us. And we know that because even in the face of what has clearly been the most aggressive variant of COVID-19 to date, our vaccinations have stood strong and tall and have done a great job protecting the vaccinated. So the message I hope everyone gains as they look around and think about all the different messages they may be hearing, what do the facts on the ground tell me? The facts on the ground should tell each and every one of us that when we look at what's actually happening, the vaccinated are doing very, very well. The unvaccinated are suffering, and we are seeing incredible numbers of them landing in the hospital, incredible numbers of them really getting sick, even if they don't land in the hospital, and having untold disruptions on their lives. And how many of them will go on to develop long COVID? How many of them will develop some of the other inflammatory conditions that result from COVID-19, including things like very severe myocarditis, all of which the data tell us, the facts on the ground tell us, are preventable. when people choose to be vaccinated. Dr. Kaminsky, I'll give you the last word. Is there anything that you would add to that?
Sure. I would only add that, with the vaccination and with COVID in general, there's a tremendous amount of noise out there. And that's unfortunate because it makes it harder for people to discern fact from fiction and to understand where truth truly exists. So I would encourage people who are considering the vaccine to turn to qualified sources that they know and trust. That might be your family doctor, it might be a national organization, but it certainly isn't social media. It more than likely isn't your neighbor, and it more than likely isn't just rumor and innuendo and hearsay that you hear from other people who simply aren't qualified to be able to make recommendations and deliver evidence in such a way that you can make that decision. So turn to known and qualified sources when making your decision. And I think you won't be let down.
Well, thank you, everyone. Again, we really appreciate your time and giving us this